Hi, I'm Allison Johnson for Windsor Regional Hospital. That building that you see behind me here, that is the new Oakville Hospital. Now, the people behind this project, they say they have a big vision for what this place can mean to the future of local healthcare. And in order to make that vision a reality, they felt it was important to start with a big, empty canvas.
50 acres was the magic number in this case, according to the man overseeing the project.
That's a lot of land. Why so much?
Well, the ministry in its own planning guidelines wants you to be able to regenerate the hospital on the existing site in the future.
When it comes to property size for new hospitals, Ministry of Health and Long-Term Care guidelines suggest bigger is better.
In Ontario, to have the capacity to grow without disruption to operations is critically important. And having the capacity in land mass, having capacity in building mass to do that intelligently, you're spending the right amount of money at the right time versus too much too late.
Here, 50 acres allows room for a modern hospital with 457 beds and more than 4 times as many parking spaces. Roads with direct highway access, a helipad, storm sewers, and decades down the road, when this place doesn't cut it anymore, there's room for another hospital right here.
You'll notice that the buildings are on that side of the campus, and this side of the campus is largely parking facilities.
Tear up the parking lot, add another parking garage, and you could build another hospital right where we're standing.
Campus. We've even taken steps to ensure that the stormwater management pond could be eliminated in the future. We could actually eliminate that pond and build on that corner of the campus as well.
You don't get that kind of flexibility with small properties.
You could build a hospital on 30 acres. Would you have the amount of flexibility and the capacity to care for your community well and into the future? Not so much. I think that having the capacity to grow to 702 beds, which we have on this site, would protect the health care for this community well into the future.
How about 40 acres? The ministry says that's the minimum requirement.
You give up your flexibility for the way that you orient your buildings. The larger amount of resource and land provides that capacity to grow more intelligently in the future.
The existing Halton Health Care site offered no room to grow, but the decision to move this hospital to an empty field across town caused a bit of a stir.
For the people in southeast Oakville, it was difficult for them to understand why they were losing the hospital in their community at first. Working with the municipality, we were able to help get the message out as to why we needed to relocate.
The municipality plans to replace this old hospital with a community center and a pool. And in Oakville North, this place is already a major economic driver.
As the growth in the community happens, the first thing in is the hospital, and as the community grows up around it, those amenities are coming to the local community as well.
Fire stations are relocating, police already have, and nearby neighborhoods are exploding.
And hopefully that's where our new employees will be living, close to the hospital.
They're not just redefining healthcare, they're redefining Oakville. And the right site was the first piece of that puzzle.
One message we heard loud and clear is don't move again. So if you move once, make sure that that's the site that's going to protect the hospital and its requirements into the future. And this is the forever home, that's for sure.